Hello, I'm Nancy Reau from Rush University Medical Center, and today I'm going to discuss the psychologic impact of PBC, addressing some of the mental health in our patients. So it's really important when we have a chronic disease that we don't just discuss the disease itself and the management of the disease, but recognize the impact that this has on our patients. So PBC is an immune condition. It has familial consequences. So we talk about family screening. And when you're talking about a lifelong problem that might also impact the person's family, this is very stressful. Stressful from, a Google search that might suggest that longevity is compromised, stressful from complications of the disease itself, extrahepatic manifestations. So this injury or this disease has a lot of fatigue, a lot of pruritus, and these are going to impact the patient in front of you when they don't feel well. And sometimes when they look healthy, this is really frustrating for the patient, frustrating for families, frustrating for coworkers who might have expectations that the individual isn't able to fulfill, even though they look healthy. And then the stress and anxiety of having something that is a lifelong condition that's not necessarily predictable. We use things like biochemical remission, so your labs to help identify a person who's doing well. But if you're not in remission, that's incredibly stressful. Or if you are in remission, but you still have anxiety, maybe a family member went through this, or maybe, that you have significant injury in the liver, despite the fact that your labs look good. These things all add impact to the wellness of the patient. And if we don't bring that into the conversation, then your patient's going to, have anxiety and concern that is going to impact their well-being when we can actually alleviate or at least put into perspective a lot of these issues. Thank you again for listening. And for more information, you can always visit the GAP website.